So loneliness today is becoming a pandemic, or it
Pandemic.
is becoming a problem across the globe. We are too much busy with our media, social media, and we are too occupied with our professions. And this is leading to much higher risk of loneliness.
Namaste and welcome to Health 360 with Apollo Pune. I'm very glad to have you all. So now I have a very special guest with me, Dr. Abhijit Bagre, Senior Consultant in Pediatrics and Head of the Pediatric ICU. Welcome, sir. We are
Thank
very
you so much.
happy and
Thank you.
glad to have you with us. So, sir, let's start with basics. How have you been?
I'm doing well. Thank you so much.
सर सो बेसिकली पीडियाट में ये होता है बहुत ज़्यादा कि हम डाउन सिंड्रोम पे ज़्यादा फोकस करते हैं. सो अभी रिसेंटली वी हैव अ डे ऑन 21st वर्ल्ड डाउन सिंड्रोम डे. तो कैन आई गेट टू नो कि व्हाट इज डाउन सिंड्रोम?
Let us understand this word syndrome. Okay, it comes from a Greek word, and what it means is collection of findings
Collection
or
of findings.
things which come together. So, medical condition or a disease or a disorder in which you find a couple of characteristic findings or signs and symptoms which are often related to a particular cause is called as a syndrome. Now, Down syndrome is one of the most common syndromes. The risk is 1 in 800.
Okay.
So 1 in 800 babies born on this earth can suffer from Down syndrome. And this is associated with certain peculiar physical findings, slow development, and in the long term, mental challenges.
Sir, I have heard a word like 21 trisomy.
Yes.
What is it all about?
So our human cells are made up of 46 chromosomes.
Okay.
And basically it is 23 pairs of chromosomes.
23 pairs.
Okay. So out of those 46, 23 comes from the mother and another 23 set comes from the father. Now 21 trisomy means on the 21st chromosome, instead of having 2 copies, in Down syndrome we see 3 copies.
Oh, 3 copies.
So that is why it is called as 21 trisomy.
So, sir, how does one develop these genetic defects?
Okay. So when the baby is being developed in the mother's uterus, the father's sperm and the mother's ovum, when they use or unite or fuse together, that time, as I mentioned, the 23 from mother and 23 from father are coming together and forming 46 chromosomes together.
Okay.
Now, ये जो पूरा प्रोसेस है, इसमें अगर कोई डिफेक्ट हो जाए, that leads to the 21 trisomy. Now, इसके पीछे भी typically 3 reasons होते हैं या 3 different types होते हैं. Let me not go into many medical details, but what it means, if you have the translocation problem versus if you have a mosaic problem, these are comparatively quite rare, but the most common being the non-disjunction. So ये 3 अलग-अलग processes है जिसमें से non-disjunction contributes to almost 95% of these patients and the rest to contribute to 5% of these patients. Now what it means is basically once you have 21 trisomy, you will see the characteristic findings.
Okay. सर, तो ये डाउन सिंड्रोम कब कॉइन हुआ था और इसकी हिस्ट्री क्या है? बेसिकली पीछे की अगर मैं बात जानूं कि आया कहाँ से और क्या हिस्ट्री थी?
In late 1850s and 60s.
1850s.
Okay. Yes. So there was a British doctor, known as Dr. John Down. He was working in a hospital in UK with mentally challenged patients. Now, जब इतने सारे mentally challenged patients, when he saw them together, he found out patterns which were observed repeatedly. और तब उन्होंने ये एक observation जो किया और उसको in fact they labeled the word as Mongolism, but later on as we understood the disease or the condition better, we today use the word which is much more mature and more inclusive called as Down syndrome. तो ये तब हुआ था. And ये जो मैंने अभी कहा 21 trisomy, to understand the basics of these genetic disorder or the condition, it took more than 100 years. So in
100.
in 1950s, Dr. Jerome and Dr. Marthe from France, they studied this, and then that time we understood the basic behind this chromosomal abnormality.
ओके सर, तो जो कंडीशन होती है डाउन सिंड्रोम की, इज इट रेयर और इट इज नॉर्मल?
जैसे मैंने कहा 1 in 800, so it is
Fine.
not rare for sure.
ओके
And if you look around, so let us understand how do we diagnose them. Okay,
Okay.
when the baby is born, the baby undergoes a physical examination by the pediatrician. Okay, and couple of findings which we see often are flat face, small nose, slanting eyes, almond shaped eyes, and then couple of findings in hands, couple of findings in legs. These are the external features, and along with that a very common finding called as hypotonia, जिनमें मसल टोन बहुत कम होता है.
ओके
So when you see these kind of findings, we suspect that there might be something unusual or atypical with this baby. That time there is a test called as karyotyping, which we conduct on the baby's blood, which helps us to diagnose the Down syndrome.
ओके सो वंस द बेबी इज डायग्नोस्ड विथ दिस कंडीशन, तो उसके आगे की स्टेप या प्रोसेस क्या होती है?
Okay. So ये काफ़ी बड़ा सवाल है.
ओके
Okay, for सबसे पहले जब ये डाउन सिंड्रोम का डायग्नोसिस होता है, it is very difficult for the parents to accept. Okay,
आई वाज
Yes.
अबाउट टू कम देयर कि जब माँ बाप को पता चलता है कि हिज बेबी और हिज चाइल्ड इज हैविंग, so I will come to this after this question.
Yes. So it is a very big question and a very big dilemma in their mind. What and why did this happen? So most of the time, this has not come from the parents. ये अभी हुआ है, ये खानदानी तकलीफ नहीं है. That is,
हेरिडिटरी
नहीं है. नंबर 2, काफ़ी सारी बार हमने देखा है कि when the maternal age increases, the risk of Down syndrome baby increases. Okay. Now, when the baby is diagnosed with Down syndrome, first of all, ये जो पूरा प्रोसेस है, ये डॉक्टर्स, सो टिपिकली पीडियाट्रिशियन, द फैमिली एंड फैमिली के साथ उनका सपोर्ट ग्रुप, एंड देन वेरी इंपॉर्टेंट, देर आर टुडे सोसाइटीज और communities, groups which are there or run by parents of Down syndrome children. तो ये तीनों चारों के साथ उनका काउंसलिंग होता है. द नेक्स्ट स्टेप इज अ डिटेल इवैल्यूएशन, क्योंकि मैंने कहा डाउन सिंड्रोम में काफ़ी सारे डिफेक्ट्स या तकलीफ़ें हो सकती है जो पैदाइशी है. तो बेबी का थायराइड फंक्शन, हियरिंग, आई चेक, हार्ट का एको, पेट का सोनोग्राफी, ये सारी चीज़ें होती हैं, सो दैट वी एनालाइज व्हाट ऑल प्रॉब्लम्स मे बी देयर.
कि किस पार्ट में प्रॉब्लम है,
और किस किस चीज़ के लिए बच्चे को हमें सपोर्ट करना है या कुछ हद तक ट्रीट करना है, ये हम वो सारा एनालिसिस करके कर पाते हैं. सो एज आई सेड, द फर्स्ट स्टेप इज डायग्नोसिस, द सेकंड स्टेप इज द acceptance by the family, which is the most important
क्रूशियल स्टेप.
and the third is then a detailed analysis.
तो नाउ सर, माय अपकमिंग क्वेश्चन जो आपने मुझे बताया कि पेरेंट्स जब एक जानता है कि उनका बच्चा इज गोइंग थ्रू विद सब अबनॉर्मल कंडीशंस और अटिपिकल कंडीशन, तो माँ बाप पे क्या बीतती है और हाउ दे फील एंड व्हाट दे गो थ्रू?
Of course, जब ये पहली बार वो जब सुनते हैं या समझते हैं, it is not easy. Okay, having said that, especially today what the parent support groups are there, they are a very big help for these parents. Okay, so एक बार आप उनके साथ बात करो, once you start interacting, you understand that you are not alone. There are lot of children and even adults who are suffering, but compared to what it was in the past, things have improved dramatically.
Okay.
If I look at 125 years before, in 1900, the life expectancy for a Down syndrome child was 9 to 10 years. In 1980, it was 25 years. Today in 2025-26, the average life expectancy for a Down syndrome person, not patient, it is 60 years.
60 years.
And this has happened because of primarily three things, three or four things. One is most important, acceptance and early intervention. तो जैसे मैंने कहा, अब जब ये डायग्नोसिस हो गया उसके बाद डिटेल एनालिसिस, डिटेल इन्वेस्टिगेशन बच्चे के साथ होते हैं, एंड वी नीड टू सपोर्ट व्हाट ऑल थिंग्स ही नीड्स. So that is called as early intervention. Next is the continued support, because ऐसा नहीं है कि सारे प्रॉब्लम्स आपको डे 1 या डे 10 पे ही दिख रहे हैं. दिस सिचुएशन ऑफन इवॉल्व. ओके, स्ट्रक्चरल चीज़ें आपको पहले दिन दिख गई, बट दीज चिल्ड्रन नीड लाइफ लॉन्ग आई चेक्स, एकोज, हियरिंग असेसमेंट इन बिटवीन, डेंटल असेसमेंट. तो ये सारा प्रोसेस है
जो नॉर्मली चलते रहता है.
Yes. So it is not very difficult, but we have to keep on working on it.
Okay.
And lastly, overall medical science में जो progress हुआ है, that also has significantly contributed towards the much better life expectancy and much better quality of life what we are seeing nowadays.
Okay. So sir, जितना मैंने अभी सुना आपसे कि पेरेंट्स और सोसाइटी को सबसे बड़ा वर्ड आई हर्ड दैट एक्सेप्टेंस. कि अगर इफ वी हैव एक्सेप्टेंस कि ये नॉर्मल है, इट इज नॉट अब नॉर्मल और अटिपिकल, सो वी कैन हैव अ गुड सोसाइटी और हम इन लोगों के साथ अच्छे से खड़े रह सकते हैं.
बिल्कुल
सर, जैसे हमने वी हैव रिसेंटली ऑब्जर्व्ड ऑन 21st मार्च, तो व्हाई इज इट only on 21st March? Is there very some history for 21st March?
Yes. So as we said, the condition is associated with 21 trisomy, that is 21.3. That is why we are being observed, this day is being observed on 21st March. Okay. Now there is another history. First time the awareness or this campaign was celebrated in 2006, but after 4 or 5 years, by 2011 and 12, in fact United Nations also understood the importance, and now it is observed across the globe. And what is also very interesting is you will see a lot of socks, different colored socks, which are used for this day's observation or celebration. Okay. तो उसका लॉजिक ये है, टिपिकली क्रोमोसोम्स, इफ यू लुक एट द पिक्चर ऑफ अ क्रोमोसोम पिक्चर, इट लुक्स लाइक अ पेयर ऑफ सॉक्स.
अच्छा, वो शेप जो होता है वो सॉक्स शेप का होता है.
सो ऑन दिस पर्टिकुलर डे people wear very bright colored, at times very funky or even non-matching pair of socks, so that people will talk about it and then create awareness. That's the whole logic about this. Nice. Another important point which I want to mention, जैसे हमने कहा कि पहले कुछ दिनों में हमें डायग्नोसिस करना है और किसी को मान लो हार्ट डिसीज है तो दैट चाइल्ड नीड्स हार्ट ट्रीटमेंट, बट मोर इम्पॉर्टेंट इज इवन इफ देयर इज नो अदर प्रॉब्लम, development monitoring of the child's development is very important. So बच्चा बैठने कब लगता है, बच्चा चलने कब लगता है, बच्चा बात करने कब लगता है, because these children, since their muscle tone is low, they may need physiotherapy in their early years of life, maybe first 2 to 3 years of life. Okay. Once they start walking, couple of them may need something called as occupational therapy. So what is occupational therapy? So that they learn fine motor movements of the hands, they learn to write, they learn to take care of themselves. So this is called yes,
work ho jata.
Yes. And the third is also the speech therapy. Some of them may have delayed speech, और काफ़ी सारे चीज़ें उनके दिमाग में होती है, they feel so many things, but if you cannot communicate, their life becomes very difficult. So speech therapy also helps for their development and overall long-term successful life.
Okay. Sir, as you mentioned कि socks वाली चीज़, तो I have heard कि जो कैंपेन्स होते हैं 21st मार्च के, जिस दिन हम इसको ऑब्जर्व करते हैं, उस दिन कैंपेन्स कुछ अलग अलग नाम के होते हैं. जैसे रिसेंटली वी हैव हर्ड दिस पर्टिकुलर डे 21st मार्च 2026, दे हैव अ थीम फॉर दिस, लाइक टुगेदर अगेंस्ट लोनलीनेस. तो इस पे हम थोड़ा अगर बात करें कि टुगेदर अगेंस्ट लोनलीनेस, व्हाई इट इज कॉइंड एज दिस.
करेक्ट. सो loneliness today is becoming a pandemic, or it is becoming a problem across the globe for various reasons. We are staying in nuclear families, or at times we are staying in different away from our houses. We are too much busy with our media, social media, and we are too occupied with our professions. And this is leading to much higher risk of loneliness. Even today, for common, normal or healthy population, the loneliness numbers are as high as 8 to
Increasing.
10%, and they're increasing. Having said that, when we talk about loneliness in these atypical children or adults, those numbers are as high as 30 to 50%.
Okay.
Now when we say they are atypical, but they are still humans, वो भी इंसान हैं, उनको भी उतनी ही feelings हैं. So that is why loneliness against
No. Together
yeah
again.
sorry together against loneliness is the word. So when we talk about that, it has principally 3 steps. First is welcoming places. So wherever they go, it may be house, it may be their family, it may be a play area, a school or office, welcoming places. Then inclusive environment. So not that they are only present in the room or present in the office, but they are included in the conversations. They are part of the whatever activity is being conducted.
हाँ, neglected feel ना हो
Yes,
at least.
and meaningful रिलेशंस, चाहे वो फ्रेंड्स हो, चाहे वो रिश्तेदार हो, चाहे वो सोसाइटी है, उनके साथ मीनिंगफुल रिलेशंस होना ये बहुत इंपॉर्टेंट है. एंड टुडे आई विल टेल यू दैट विथ ऑल दीज मेजर्स what are being done, so there are children who are having Down's syndrome but who are attending normal schools, and they are doing reasonably well in 9th and 10th standard also. There are children who are doing very well in sports. I know a person who is a national level swimmer.
Okay.
There are children or there are adults who are who are very good in yoga. And now let me talk about one step ahead. There are adults who have come from very caring and very supportive families and communities, and they are today being employed for simple jobs, fine, but they are still contributing meaningfully to the society. It may be a job in hotel, or it may be a simple job in office, or it may be something like retail shop, but they are contributing meaningfully. There are children who are now yoga teachers, the swimming teachers. So there is a lot of scope for these children also. And ये जब सारी चीजें जब parents समझते हैं, when they understand, okay, my child has Down syndrome, but when they are connected to bigger world and bigger communities which have these kind of role models, that is when they also become more open to understand and more able to work on this kind of situation. Also let me tell you, जिस घर में या जिस ऑफिस में या जिस स्कूल में एक बच्चा या एक एडल्ट है जिसको डाउन सिंड्रोम है, and when the entire group is working with them, what we have often seen, even in children, other children, they become much more caring, they become much more supportive, and most important, the leadership skills develop. Because आप सोचो, एक बच्चा है जिसको डाउन सिंड्रोम है, उसके बाजू में बैठने वाला बच्चा, he helps him for every going
Smaller
to
things.
very small things, and that leads to developing these leadership skills, and that is very important. So जैसे डाउन सिंड्रोम बच्चों के लिए या एडल्ट्स के लिए ये जो इंक्लूजन है ये जितना इम्पॉर्टेंट है, उतना ही हम सब सोसाइटी के लिए भी उतना ही जरूरी है.
So, sir, my next question is, can this condition be prevented? Or my next up to this question is, can it be cured?
Okay. So, as I told, Down syndrome is a condition which is not very uncommon. And especially if the mother, the pregnant woman, is old, more than 30 years or 35 years, when the risk increases, or if she had a child with Down syndrome, again obviously the risk of the next pregnancy getting Down syndrome increases. So today couple of tests which are done quite often. One is a sonography at 11-12 weeks of pregnancy, which looks at certain findings like knuckle thickness. Then there are a couple of blood tests which are called as triple test or quadruple test. And then if you want to be very specific and be sure that if the condition is there or not, there are tests like chorion villus sampling or amniocentesis which can be done. And a very recently a newer test which is available called as NIPT, non-invasive prenatal testing, where we just check the mother's blood in which the baby's cells are also found and they are analyzed. So it is available and it is very helpful to diagnose it in first or second trimester. Okay. So can we prevent it? Difficult to say that, but can we diagnose it? Then you also asked me, can this condition be cured? So the answer is, if there is a child who has a heart disease along with Down syndrome, or who has a thyroid problem or any other problem, so those things we can treat and maybe cure. But this Down syndrome being a genetic disease, every single cell in the body is having an extra chromosome. We cannot cure it. We cannot cure it to normalcy. However, we can definitely support, manage, guide in the ways we described and help them to live a good life. Also, I want to highlight one point. These are the children who are very happy going children, very loving, very caring. So the family in which there is a Down syndrome child or a school, you will often find that these children are very attached to the friends or their families, and they are very caring also.
तो सर इट वॉज वेरी नाइस. जैसे मुझे बहुत अच्छा लगा कि मैंने सारी चीज़ें जानी डाउन सिंड्रोम के बारे में. आई थिंक आवर व्यूअर्स ऑल्सो गेट टू नो और दे गेट ऑलरेडी. सो आई जस्ट वॉन्ट वन थिंग. कैन यू हैव अ वन स्मॉल मैसेज टू आवर व्यूअर्स?
Correct. In context with the same theme what we are celebrating, I would say we are trying to build a world where everyone belongs to and everyone is cared for.
Thank you so much, sir. This session was very insightful and I get to know about this thing, and I think my viewers also loved this conversation.
Yes.
From next year, we'll definitely promote this more or spread awareness regarding this. Thank you everybody. This was a very insightful conversation with our doctors. और ऐसे आपको आगे भी हमारे बहुत अच्छी engaging और inspiring conversation मिलेंगी. And also do like, share and subscribe our channel for more inspiring conversations. Thank you.